Okay. Hi everyone, my name is Radha Ramachandran. I'm an emergency medicine doctor and I'm the medical director at Strong West, which is like a small affiliate of Strong. Has anyone ever been to Strong? It's just a very busy, crazy place. We see all kinds of patients. Um, this is just a slide set I found from the American College of Emergency Physicians to kind of promote what we do. So we'll probably just go through this and I'll tell you a little bit about myself and then we'll do a little Q&A.
Don't worry, she's only got the introduction of who she is. You haven't missed anything, ladies.
I have some props and books here too, if you want to look at them. He's wrote a little speech. Oh, so I was just going through my little introduction. My name is Radha Ramachandran. I'm Charlotte Syria Man's mom. I'm an emergency medicine attending. I work at both Strong and Strong West, and I'm a medical director at Strong West, which is like a small affiliate of Strong. And this is a slide set I found from the American College of Emergency Physicians, which is what our kind of umbrella group is. So I'll go through a little introduction, then we'll do like a large Q&A. So this is just something I found on the internet, but it seemed like a good presentation, everything you wanted to know about emergency medicine. So this is just a broad overview of what it is, and then discussing the pros and cons, describing what the kind of training is that it entails. Does anybody know what emergency medicine is? We just kind of take care of all emergencies, all comers, from like in utero pregnant people to all the way older people who are dying. And we kind of what our definition is we stabilize and resuscitate all comers, all illnesses and injuries without regard to anything else. Pretty much we don't even know what their insurance is, if they have the ability to pay, we just treat everybody the same. We diagnose and treat and try to figure out what's wrong from head to toe, every body system, every kind of problem. And we do a lot of different procedures. So it's a really fun specialty. It's very exciting. And a lot of my colleagues are like adrenaline junkies. They just love the excitement. And I'm probably partially adrenaline junkie too. So the first emergency medicine residency was in 1969. So it's relatively young specialty. Started in Ohio, about 50 years old. This was taken from a while ago, but just the different leading causes of death, and now like COVID's going to be in there too. Heart disease, cancer, stroke, COPD, accidents, car accidents, all kinds of accidents, pneumonia, influenza, diabetes, suicide, kidney disease, liver disease. So this is like a lot of what we treat. Different things like we might see in the same day: heart attack, car accidents, gunshot wounds, CPR, and especially at Strong, you see all kinds of things like I worked the day after that whole incident at the Armory where all those poor people were suffocated in the trampoline incident. So a lot of my colleagues took care of those patients, and just very sad. So you see a lot of very interesting and crazy things at Strong. And unfortunately, those people, some of them died, but then we resuscitated and stabilized some of the other patients. So there's some good stories. This is just an example of a heart attack and diagnosing it on EKG. And I brought like a number of different books, which you can pass around, because we treat like heart attacks, fractures, skin diseases, all kinds of different things. So our specialty just kind of encompasses all body systems. It's very interesting and exciting. It just also means that our field is very like lifelong learning. So it's something you're really in it for the long, like for your whole life. You're constantly learning. This is an example of an accident with bleeding in the head. So not all of it, some of it's very exciting and all the crazy stuff, the gunshot wounds and the heart attacks and strokes. And then you have your run-of-the-mill patients, like your asthma, emphysema, alcoholics vomiting blood, fevers, kind of ruling out other infections. We see a lot of pregnant people too, and try to figure out what's wrong with them. Non-emergency, so we as you probably know, there's a little, just with the way things are in the government, etc. I won't make a commentary on that, but a lot of uninsured patients who are like a safety net. So you'll see like people who are not emergencies, and you got to be okay with that. And honestly, I like seeing the non-emergencies because it's like a mental break. So you might see like someone with a rash for 3 months, or a homeless who just wants a sandwich, or like doesn't have a place to go in the freezing cold. And then we just like kind of wink at them and let them stay in the emergency room, honestly, because I'm not going to kick them out to the freezing cold. Back pain for 3 months, migraines, we see lots of migraines. People who can't like tolerate their medicine at home, and they want like IV medicine, and I think migraines are a pretty debilitating condition. And also like medication refills and that sort of thing. So that's not particularly exciting, but you're definitely helping people. So there's like a lot of different employment opportunities. You can do teaching hospital, like strong, or community hospital, urban, rural. Locums, like if you're like not encumbered by like spouse and kids, and you just want to make extra money, the locums physicians, meaning they like travel around and go where they're most needed, they can really help a lot of people, and they make extra money, obviously, because they're traveling to like rural, like whole bunch of towns and like Iowa and this and that. So that's be exciting. International opportunities, third world opportunities, cruise ship medicine, because we're very valued, because just we can see any kind of patient with any kind of problem. So we're definitely have a lot of opportunities. And some of my colleagues have gone to like Borneo, South Africa, like all over the world. And we even have like a fellowship for international medicine. So pretty cool. Different appeals is that you can make an immediate difference in someone's life. You can really save a life, treat the life-threatening injuries, kind of figure out what's going on with a patient who just says they don't feel well, and they can have like anything under the sun, and you got to figure it out. And there's a challenge of anything coming in. So like even in the middle of the night, I work a lot of night shifts, and it's just like you can never really feel completely relaxed, because there's always the next minute something crazy or insane to come in. So part of that is exciting. Lots of emergency invasive procedures, like we're constantly like intubating, CPR, defibrillating. I don't know, does anybody watch the ER show or any of those medical shows? Kind of have an idea of like all the interesting stuff you can do.
You guys are calmer.
What'd you say?
You guys are calmer. In the TV shows, they're like, in fact, I've been in the ED, not my personal self, but observing.
Yeah.
And you guys are so much calmer that it's hard for me to watch those shows.
Yeah.
Because you don't like hop up on a gurney and like, like they do TV drama. You guys are just like chill.
Yeah. Yeah, some of the like nicest people I know are like my colleagues. I mean, maybe just because they gotten to know them, but like they're just really good people, and they're actually pretty chill and nice to talk to. And despite everything that we see and go through. Like a lot of them are very like cool, calm, collected, chill people. I consider us the safety net of healthcare because we, like I said, we take care of like all comers, like the poorest of the poor have nothing, homeless, like we're just trying to help them. So another appeal of emergency medicine is that it's very team oriented. You just work closely with a lot of different people. You're always a patient advocate, like we're constantly on the patient side. Open job market, I mean, lots of jobs. You'll never be without a job. Academic opportunities, shift work, set hours, evolving specialty. Like when I had my kids, I had them back to back, and when they were very young and toddlers, I just worked part-time, or I told my boss I could only work weekends because we didn't have proper childcare. So it's very flexible. You can kind of set things the way that you want them to be set, especially if you're willing to work weekends and nights, they'll just like work with you and you can kind of flex it out. So it's very good for women, I think. Downsides. Well, yeah, so some people are angry, intoxicated, violent. You just have to treat them all the same as you would other people. Having to take care of like some people are brought with against their will to the emergency room, and you have to treat them the same. They might not be the most polite or nice to you, but that's just a small part of what we do. And yeah, there's not too many negatives. It's a great field. So I guess this is about the lifestyle. So well-defined shifts. So like when you're off, you're off. Like if I work 7 to 3, then like after 3, I'm off and I can just relax with my family and no one's going to be calling me about a patient or anything else because I sign out to my next colleague and they take over the patient. So you're just kind of free. Like when you're free, you're free. And when you're working, you're working. So a lot of medicine isn't like that. Like you're just like a 24/7 job. So that's the beauty of it, kind of. There's a downside in that you're working some evenings, nights, weekends, holidays. So like when like say a pediatrician or internal medicine doctor might have weekends and nights and holidays off because the office is closed, well, someone has to man the ED. So we all share it. There's a lot of subspecialties. This is like an older slide, but some of the most popular are pediatrics, toxicology, EMS, like that's a whole subspecialty, pre-hospital medicine, sports medicine, like a lot of people do sports medicine, really love it. Critical care, one of our residents is going to do disaster medicine, which I think is so neat. Like, man, it sounds really alluring, like going to all the disasters and helping with those. Palliative care, so people at the end of life, easing their burden and helping them. I don't know, that sounds so nice too. Ultrasound, so a lot of subspecialties. Yeah, and there's like usually emergency medicine doctors meander like every marathon, every concert, every mass gathering. You can kind of see why that's necessary. And then of course we like flock to whenever there's disasters. There's other like the upcoming areas: observation, ED ultrasound, international emergency medicine. Just like a very broad range of subjects, as you can see all those books. Like you just need to know a lot about a lot. It's very vast. This is an older slide. There's like this was 2000. So there's like probably triple now. This is some of our parent organizations. Our big one is ASAP. We have like a big conference every year, which like tens of thousands of emergency doctors go to, and we talk about all the newest innovative stuff. And it's just a really exciting and great field. These are some different websites, but I know you guys are you're just learning about medicine in general. This is more geared towards medical students trying to learn more about emergency medicine. Some of our publications, and I passed out some of those publications. In EM interest groups. We do lots of procedures like suturing, abscesses, dislocations, ultrasound, splints, intubation, defibrillation, central lines, tubes in the chest when people have a collapsed lung. So lots of hands-on, I guess is what I'm trying to say. This is for medical students, but of course, if you're even like considering a career in medicine or emergency medicine, you try to like shadow or do an internship or try to figure out if it's really for you. Finding mentors. It's just for students to try different rotations and shadow. And there's a lot of combined programs too, like emergency medicine, pediatrics, emergency medicine, internal medicine, or critical care. Oh yeah, the money the money is good. It's like based on how many hours you want to work. So if you only want to work, you know, like 6 to 8 shifts a month, you'll make less than someone who's making working 20 shifts a month. One of my friends, really gung-ho, I think wants to retire early, works 20 shifts a month. So it all depends on you. So it's very flexible, very awesome field. Can't say enough about it. In the beginning of COVID, we were like really the heroes of medicine. So that's pretty cool. And I'd love to take any questions. I wanted to bring candies and snacks, but I just didn't get around to it. And it is like no food science, so it's good that I did.
You guys have any questions?
Okay.
What was your experience during this like
It was really scary, like in the beginning days when no one was vaccinated and like a good percentage of people were dying because they got so sick. It was like extremely scary. But now, obviously, everyone's vaccinated up, everyone's gotten COVID. Many people have gotten it multiple times, and it's not that way. But it was very, I would say, fear-inducing, apprehensive. Like none of the other doctors seemed like they wanted to come and help us. So it was just the emergency medicine doctors doing a lot of the groundwork.
Did you find that a lot of emergency medicine were fearless about it? And as opposed to we're saying other physicians were coming in and were kind of like apprehensive, because I know that some of them were like, the feelers went out to other doctors to say, to offset, and they were like,
yeah, like
did you find it within your own sphere of emergency people that everybody was all hands on?
for the most part, I think it burned out a lot of people, and it burned out like some of the people just starting out nurses and stuff said that they just didn't feel the risk was worth it. But I think most of the doctors, we've been through so much to get to this point that we were kind of the front line. Yeah.
how much school did you go through?
So you have to do 4 years of college, then 4 years of medical school, then emergency medicine residency is either 3 or 4 years. And then beyond that, you have to take exams every 10 years, but now they change it to every 5-year certification. So it's really, you have to love reading and lifelong learning.
When did you know you wanted to work in emergency?
So yeah, I think I'm a little bit unique because I always knew, like ever since like my mom was an emergency medicine doctor. So I think that sometimes people, when they have parents in the trade or the field and they see them going to work and with all their paraphernalia and all their books and journals, they just, I don't know, my sister's not a doctor, so everyone's different, but I just, I always knew, I always had the passion for it. I was like willing to go through it, any and every hurdle to do it. And I don't know if I recommend medicine to people who don't have the passion. It's because it's like such a long, hard road, and I wouldn't do it just because someone told you that was what you should do. But like I've always had this inner drive to do it, and then I like sometimes when I'm really tired and I realize I'm working all these night shifts, I just think back to those old days when this was like my dream, and then it's like, okay, I'm an emergency medicine doctor, so should we have gratitude?
Are the big like tests like every 5 or 10 years for like every ailments?
Pretty much, yes, because they all expect lifelong learning. Because if you even think like a couple of years back, how different technology was, or how different, like, just it seems like everything's just like this upward slope of like discoveries and research and innovation. And of course, you want your doctor to be all up to speed on everything. So it's constant. Yeah, every field.
How many more years did you have to do between your schooling and residency versus like a pediatrician or a GP or
Oh, it's the same.
it's the same?
Yeah, because our residency is 3 years. Most of them are 3 years. There's a couple that are 4-year programs, and pediatricians 3 years, and internal medicine 3 years. Something like neurosurgery would be like 7 years. They just go up with the really in-depth surgical specialties. You just go up in years. Yeah.
Like an average day where you work, how many patients?
Oh, that's a good question. So some days are like really busy and they're like hustling 4 patients an hour, and then some days it's like 1 or 2 patients an hour. But hardly ever just like twiddling your thumbs, and like especially at Strong, like there's always like infinite work. Like there's patients in the waiting room you can go see, or there's just it's a very busy place. Yeah. Depending on how fast you are and how like skilled you are and how ambitious you are to want to like see all those patients, because especially if you're a bit too strong, the patients are like just lined up in the waiting room. So you can skip your lunch and skip your bathroom breaks and just keep seeing patients if you really wanted to.
I think you already answered this, but you get to choose when you want to do the shifts, right? And then like how often do you do night shifts?
So we all share them. I think once you're over 55, they say you're exempt, but the rest of us share them. So I do about 4 a month. Everyone's different, and I don't like get to choose when I do them. So it's just based upon what they need. Yeah.
How much of like the weight of your work do you feel like carries outside of your shifts?
Yeah, sometimes I just keep like thinking about like, especially if it's like a really sick patient, or it's it's hard for me to see like some of the accidents, because they're not meant to have I don't know, I just ruminate about it. So everyone's different. So I don't know, maybe once every 10 shifts or something, I'm really like thinking and overthinking about a patient and something distressing I saw or whatnot. But most of the time, I'm done it for so many years now that I just leave work at work. Yeah.
Do you like only handle like initial triage, or do you like follow the patients like through their care and like you see how like they end up?
So we do the initial stabilization and resuscitation and like get them admitted, or if we can discharge them, we discharge them from the hospital. But it depends on you, like how much you want to follow up. Like we're always like welcome to go see the patient in the hospital, or talk to them, or as a lot of times if they're admitted to the hospital, I kind of follow up day to day and see how they're doing. So you don't have to feel limited just because you're an emergency doctor, but I guess it depends on you. Not too much follow-up. But even if you discharge your patient, like if I discharge a patient with abdominal pain, I might call them the next day and see how they're doing. Depends on you.
Second stories where patients you see.
Well, a patient, I'll just say, recently, it drove up to our Strong West and was like having chest pain, and then they didn't call an ambulance, so they like ended up in our parking lot without and they just kind of lost consciousness and without a pulse. So the nurse had to get in there and do CPR. So that was, we had to like drag the patient out of the car and then resuscitate them. And then we actually, they're alive today. They're like, we had to shock them a bunch of times and take control of their airway and give them all the life-saving medicines. And it took a really long time to get their pulses back, but we did. So it's almost seemed like a miracle to me. Like I just didn't expect it, and pretty cool for a lot.
Are there any differences between the children's emergency department in Strong versus the adult department?
Yeah, they mostly a lot of their doctors are pediatric emergency medicine trained. So above my training, they do another 2 years. So they're very advanced in pediatric emergency medicine, and we're a tertiary care center. So like we get like all the referrals from all like Syracuse to Buffalo, like, and north south people patients are flown in, brought in from like all those like regional hospitals, and it's just amazing advanced care there. So, really good. I hope to never see you guys in the emergency room. You guys stay healthy, and the biggest thing I would say for prevention to stay out of the emergency room is like definitely never. I know you see like this on commercials and everything, but never ever drink and drive or text and drive, because the number of accidents I see from like upstanding, nice children like you guys who do those things and get themselves into a pickle is just so much. So just, yeah, if there was like one thing I could tell you, stay out of the emergency room.
You?
Oh, thanks.